Hi everyone, my name is Sophia Bouzid. I am a senior biology and public health double major and a pre-medical student. I am interested in pursuing podiatric medicine. I'll actually be starting a program in the fall. So my project kind of encapsulates all of my professional interests in healthcare and public health. It's entitled A Diabetes Wellness Program and Diabetes Prevention Model. So I actually worked with a community health organization called Roots Community Health Center, located in Santa Clara. I was an intern for the diabetes prevention team, and I actually designed and implemented a wellness-based intervention program. So why did I choose this as my senior honors thesis problem? Um, so shockingly, 11% of adults in the United States are currently living with type 2 diabetes. It's a very prominent chronic disease that inevitably puts a lot of strain on the healthcare system. Um, but what's hopeful is that it's actually easily prevented. A lot of that comes from early intervention, screening, and lifestyle choices. But unfortunately, due to social and structural determinants of health in this country, prevention is a lot more difficult for certain demographics of people. And so I wanted to fixate on Santa Clara County specifically, and narrow down my population of interest. So some descriptive epidemiology of my POI is 8% of adults in Santa Clara County are diagnosed type 2 diabetics, which is similar to the national statistic. However, a shocking 46% of adults are estimated to be pre-diabetic or undiagnosed type 2 diabetic. So the extent of the issue here is reflective of the high demographic of underserved individuals. There's a lot of segregation across neighborhood lines, which I will touch on when I show a demographic map later. Um, but diabetes disproportionately affects low socioeconomic and minority populations. And this is due to social determinants of health like lack of education, language barriers, lack of health insurance, and then some structural determinants of health like racism in the American healthcare system, lack of walkability of our cities contributes to a sedentary lifestyle. And then, as well as food deserts, a lot of people struggle to get the proper nutrients that they need in order to eat a balanced diet. Produce is expensive and hard to come by. And all of these factors contribute to why we see so many people living with type 2 diabetes. So this is a map of Santa Clara County. In the red zones is actually where the most densely populated type 2 diabetic demographics are located. This graph was actually found on the Santa Clara County Public Health website. And what's interesting about this is in these pockets of neighborhoods is actually a high percentage of Latinx populations, low income populations. So we can kind of see this like well-known correlation between low socioeconomic and minority populations bearing the brunt of chronic disease. So my methodology for this, I created a intervention with a grant that was given to Roots Community Health meant to um, kind of work on wellness initiatives for the patients at Roots. Um, Roots patients are typically low income, often have very complicated chronic disease because their diseases have been left unmanaged. So instead of focusing on another intervention, maybe explaining details of the disease and the medications and the pathophysiology, we wanted to create an opportunity for people to experience community building and set aside time for themselves to work on their goal setting, work on their healthy eating habits, and work on their low impact physical activity with peers. So the project is entitled Roots and Routes: Cultivating Wellness. Um, as an SCU student and as someone who has previously interned with the SCU Forge Garden, I thought that it would be a great opportunity to establish a collaboration between Roots Community Health and the Forge Garden, because gardening is actually a great form of low impact exercise. Um, there's also numerous studies that show gardening has a positive effect on mental health, physical health, and community building. So I saw that opportunity and we established a partnership. So the first part of the intervention features community gardening every third Friday, which will be continued even after I graduate at SCU, which is awesome. Sustainability. And the second part are walking groups. So these will be held around the South Bay Clinic location in Santa Clara. They'll be preceded by a formal presentation on various topics that range from goal setting, healthy eating, diabetic foot care, um, amongst other important wellness topics, towards managing diabetes more effectively. This program is also incentivized. We utilize the social cognitive theory, of providing incentives to reinforce positive behaviors. Um, so we provide patients Tango gift cards, which are basically redeemable cash gift cards for usable gift cards of their choice. And we also designed some foot care wellness packages. I am a future podiatric medical student, so my interest is in preventing diabetic foot ulcerations. Uh, these ulcerations and potential amputations of the foot and lower extremity are really easily prevented just by taking care of the feet. So this can look like making sure the skin is not dry, so it's not cracking, making sure that someone who has diabetes is not cutting their own toenails. Um, since they have neuropathy in the lower extremities, they can't feel their feet. So what happens is they eventually, um, if they don't check their feet, they can have lacerations or lesions that don't heal properly, become infected, can fester, become an ulcer, and then if that ulcer is left untreated, can lead to an amputation. So this is what we're trying to prevent with this aspect of the wellness program. Also, a shocking statistic is that 71% of amputations in the United States are diabetic related amputations. So this is a larger problem than most people would think, even larger than I thought before I worked on this project myself. So this is an example of one of the deliverables that I created. This was a handout to go along with the healthy eating presentation. And what it's there for is to hang on participants' fridges. It is meant to contribute to more sustainable produce storage, so making produce last longer. And the reason this is important is because produce is expensive and these patients often need to make food stretch. So I created things like this that I think they would find helpful, easily digestible, and hopefully we continue to hand these out and hopefully participants find them helpful. So, um, for results, we're still in the process of implementing these wellness groups. We've only done one walking group and one gardening session. We disseminated pre and post surveys to the participants. Um, and that data is not yet fully collected, so I'll be analyzing that by the time I graduate Santa Clara. But for now, what we do know is that 100% of the participants reported an increased understanding of the wellness topics discussed, and 100% of the participants plan to continue the program. So as you can see in this picture, two of our participants are conversing at the Forge Garden. We were really glad to see the community building aspect happening. I think when you give people a space to, talk about their struggles and relate to one another, that's where we start seeing these peer support networks forming, which is, I think, so important in managing a chronic disease like diabetes. And then the next photo is of me and my fellow diabetes prevention team coworker Harmon, giving our first of the 5 series educational classes before the walking group. So, yeah, thank you so much for listening. If you have any questions at all about my project or what I studied, feel free to email me at sbouzid@su.edu. I might be getting a new alumni email soon, so I think they might be standard. I have a pretty unique last name, so hopefully if anyone has questions in the future, I will be easily reachable. Thank you.